Today's webinar topic is on managing resident, fellow, and faculty surveys. The topics are quite rich and focused on your content, very specifically, that you're using for your various assessments. Not so much of a focus on your rotation assessments of the residents' performance, but more so on surveys of the program itself. So our focus really today is on developing surveys to meet the ACGME Common Program requirements in terms of enhancing your overall program performance, getting more engagement from resident fellows and faculty, and improving the satisfaction in your program, and also preventing issues from coming up when you have a site visit or you have your annual ACGME surveys done by the ACGME directly. Our intention is by the end of this session that you'll know how to design surveys and utilize the ones that we've already also provided for you to be able to collect meaningful feedback that makes you, helps you improve your program as a whole. The content is not just designed for ACGME accreditation, but that's the main focus of what we're doing today, and really trying to focus on how you want to design evaluations that are most effective. Our webinar is scheduled for about an hour and a half, and the key topics that we're going to focus on are how to create effective surveys in terms of how to design them to get meaningful responses, the survey distribution process, and implementing strategies for an effective distribution and data collection for high response rates, and then how to analyze the results and where to analyze those results. And then at the end, I have a series of 5 case studies to look at best practices so you can gain some insight into how to best improve your program as a whole based on other programs and what they did and how they were able to improve themselves. Should you have any questions, please go ahead and write them into the question field, and we'll do our best to answer those questions, and we'll allow for questions at the end as well. The expectation here from doing these surveys is your ability to be able to gain actionable insights. This is an overall theme that we're focusing a lot on in 2024 going into 2025, is the idea of having actionable insights. If you review the new My Insight narratives that are being generated on your residents, you'll see that for the overall My Insights and the 6 core competencies, we're also focusing on actionable insights. The idea being, if you're generating surveys, well, will these surveys help you actually make informed decisions that can enhance the residency program as a whole? The best example being using the well-being survey that we offer you, and you can, of course, customize and design yourself to address work-life balance and increasing your compliance with ACGME requirements for the work-life balance. And certainly that work-life balance is more and more a part of residency programs in 2024 and moving forward, if we compare it to how things were maybe 10, 15 years ago. So that overall creates a better environment for trainees. So in creating effective surveys, it's important that you get feedback that allows for that improvement and assures your accreditation compliance. So the real key elements of a successful survey is you have to have some clear objectives. As a group, you should sit down and identify what are some of the specific issues that we have had in our program in the past. Look at the last 5 years of your site surveys from the ACGME, and then tailor your questions based on either the residents or the faculty, depending who you're going after, to create surveys that are really tailored to those specific groups to address those clear objectives. by really carefully selecting questions that are relevant to those group experiences. It's not about creating a survey that has 15, 20 questions in it and just to do the survey and get results, but really an objective orientation of this is what we're going to focus on. Even having a survey that has just 5 or 6 questions in it is sufficient to help you address your objectives. And as you'll see as I go through this process in terms of how to improve the compliance with the surveys, you'll see that creating a clear objective survey where you're focusing on something meaningful is a big part of getting your faculty and your residents to actually participate and complete these surveys in a meaningful way. An example of that would be resident surveys of the program, where you can focus on rotation experiences, while on a faculty survey, you can emphasize on teaching effectiveness. By having a clear objective of what are your rotation experiences and having specific items, which I'll give you examples on during the latter portion of this webinar, you're now directing the residents to think about, hey, we want to know what your experiences are like, not about the asking 15 different questions about the residency program as a whole, which is what folks have done mostly in the past. So another important part of these effective surveys are the types of questions that you ask and the scales that you use. So using Likert scales, where it's a scale of, let's say, 1 to 5, to collect quantitative data, like rating the quality of supervision during a clinical rotation, that's very appropriate. Sometimes it's appropriate to have qualitative insights where you ask more open-ended questions, such as what is one area where the residency program could improve? And asking those types of open-ended questions allows the residents to give you an overall insight on their own experience rather than asking a very, very, very specific question. So a much more open-ended question. Certainly avoid subjective and yes/no questions unless it's really absolutely necessary. So the aim here is to have questions that give you more comprehensive feedback rather than a simple yes/no. Is the residency treating you well? Yes, no. You're getting results, but what are you going to do with those results? You have to ask yourself. And the truth is, you're not going to be able to do much with it at all. So additional tips for better survey designs are to keep questions concise and relevant. You want to avoid survey fatigue. Again, my focus today will be on 5 or 6 questions on a survey. This way you can do them not just once a year, but you could do them 3, even 4 times a year, at least twice a year. 5 questions are very easy for people to answer, and it'll actually surprise them. Wow, that was really easy. You want to encourage the respondents to be very honest, and the way you're going to do that by reinforcing the anonymity. We have tools in My Evaluations that are available under the My Help directory that outline the anonymity that we enforce within the system so that residents can feel and faculty can feel comfortable in providing you feedback without fearing there might be some reprisal for the comments that they've made. Of course, we certainly hope that everybody's always behaving professionally. And we encourage you to review the sample surveys that we have already designed in My Evaluations, and I will certainly review those as we get further on into the webinar. So let's look at an example of creating an effective survey. So as an example, let's look at a semi-annual survey for residents. I said let's focus on an objective. So our objective here is to gather feedback on rotation experiences, work-life balance, the support system, and feedback on to identify areas for improvement and how we can enhance the residency satisfaction overall. So in this example, I have 5 key questions. The first question is on rotation experience. And it says, how would you rate the overall quality of your recent rotation in terms of educational value? So this is certainly a subjective question, but in this case, it's very important to collect that kind of subjective feedback. Obviously, if I get feedback on this question where everybody feels that the educational value was excellent, that helps you. If you're getting a lower score where people feel that the overall educational experience is the overall score ends up being a 2, that tells you that it's a poor experience they're having. Now you might ask yourself, well, how do I know which rotation this is for? The focus is not on identifying which rotation is giving a poor experience. Remember, when the ACGME does a site survey and asks your residents to give feedback, they do that once a year. And when they ask them questions about their work-life balance and whether they get enough rest, it's not, you have no control over when that's happening. You might have a resident that's doing an ICU rotation, working 24-hour, 28-hour days, and at that point they might feel that they don't have a work-life balance. But the expectation is that the overall survey response is going to be balanced out by other people who are having less stressful rotations. So the idea here is, am I going to get an overall poor rating, or am I going to get an overall excellent rating? And if you're getting a poor rating, that gives you a nidus to design another survey that focuses on specific rotations. And then you can ask specific questions about specific rotations. This is where you will look at rotation-specific evaluations and see what the quality of the educational experience is within those rotations. The other 5 questions include work-life balance. To what extent do you feel that your workload allows for a reasonable work-life balance? And here we're focused from unbalanced to very balanced. Again, in this case, I acknowledge that we're not asking a specific question about a rotation, but that's not the idea here. Here is, again, general question: quality of feedback and supervision. How effective was the feedback provided by your supervisor in helping you improve your clinical experience? Support systems. How supported do you feel by the program in managing stress and maintaining well-being? And program improvement. What improvements would you suggest to enhance the overall learning experience and support system in this program? And in this case, we're using an open-ended question. So these 5 questions, which can be answered very easily using the mobile app, this would be maybe a total of 5 minutes of their time to provide you specific feedback on their user experience in their clinical learning experience, their work-life balance, their supervision, and what type of support is being offered within the program. Gives a very good starting point for you to say, okay, I see where our program is. You can expect to be able to collect data on this in a relatively short amount of time. And then what do you do with that? If, let's say, on the work-life balance, you get responses that are on the lower side of the scale, where people feel that they are very unbalanced or they are poorly balanced, well, that becomes an excuse for you to then utilize one of the surveys we have within the system, which we'll talk about later on, such as the Oldenburg Burnout Inventory by residents. This survey allows you to hone in overall on well-being balance within the program. We have a separate webinar where we've talked about the well-being survey that you can generate, how you should generate it twice a year in the month of November, like right now, and again in the springtime. That webinar focuses on this survey and tells you how to utilize this on a semi-annual basis. But that's where the assistance comes in. Here, you're just asking some very basic questions to help you as a guide. So again, change your mindset and don't think that you have to do one survey and that one survey has to have everything you need in it. Here are 5 very simple questions with very simple scales. And then on the mobile device, it's on the open-ended question, they're able to use the microphone to record and record their feedback. And the mobile app will actually convert the recording into text. So they're essentially dictating their narrative directly into the mobile device. And you want to really utilize that in an effective manner. So in terms of these surveys, that focus on what you're trying to garner becomes important. So now let's focus on faculty here. With faculty, we want to collect feedback on their teaching effectiveness, the curriculum quality, resident engagement, and overall program support. Think about this from the perspective of faculty. If faculty feel that the program is not supporting them, if faculty feel that residents are not engaged and are not enthusiastic about the rotation, this becomes a negative impression on the faculty that are teaching on those rotations, and that breaks down the overall experience. So here from the faculty, we're going to focus on 5 questions. Teaching and curriculum effectiveness. How effective do you feel the curriculum is in preparing residents to meet ACGME competencies? Very general question. We're not focusing on specific topics. We want to get an impression from the faculty. Resident engagement. To what extent do you feel residents are engaged and motivated during clinical training and educational sessions? Quality of resident feedback. How often are you able to provide timely and constructive feedback to residents after procedures or patient interactions? Support for program leadership. How supported do you feel that by the program leadership in your role as an educator and supervisor? And then at the end, we have another open-ended question. What improvements would you suggest to enhance the teaching environment and support for faculty in this program? So the combination of these 2 surveys, both from the resident's perspective and from the faculty perspective, gives you an overall idea of where are some of our strengths and weaknesses. And now imagine doing such a simple survey that does not require a tremendous effort from your faculty and residents. Do this twice a year, and you will utilize this data as part of your annual program evaluation process, allowing the program evaluation committee to get a bird's eye view of what are some of the issues in the program. The program director is able to look at the results of these surveys ahead of a program evaluation committee meeting, and is able to make suggestions for doing additional surveys that focus on specific areas. And I'll show you those 5 cases as more specific examples. So for these 2 types of surveys that I've just shared with you, let's now talk a little bit about survey distribution. So in terms of timing, we recommend that you distribute these surveys at key points, such as certainly end of rotation evaluations, but more so in these more general surveys, they would be as mid-year check-ins. Mid-year typically means the early part of November, before you get deep into